Pnawn da, croeso. Good afternoon and welcome to Public Health Network Cymru's webinar series. Today's session is A Healthier Wales for Future Generations, the findings and recommendations of the Future Generations Report 2025. My name is Jenny McConnell and I work as a Sustainable Development Advisor for the Future Generations Commissioner's Office. This means I work closely with public bodies to help them implement the Act. But I work primarily on the health mission, supporting our work on prevention and the social determinants of health. Marie Brousseau-Navarro, Deputy Commissioner, will present the findings and recommendations in the health chapter of the Future Generations Report 2025. In her presentation, she will cover the urgency of the current state of health in Wales and present some of the solutions we are recommending and good practice that we have seen in public sector organisations. Marie is adopted Welsh, originally from France, and a lawyer who joined the first Future Generations Commissioner for Wales's team in 2016. Since 2023, she has also been Director of the Health Mission, driving forward the Office's work on prevention and wider determinants of health. She started as the Director for Policy, Legislation and Innovation, and she became Chief Operating Officer and Deputy Commissioner in 2020. Marie leads an amazing team of over 20 highly motivated individuals and makes sure they and the organisation have everything they need to promote sustainable ways of working across the wide Welsh public sector and to act as guardians of future generations' needs and report on progress. In addition to working closely with the Commissioner on the advice given to public bodies and the design and delivery of the Commissioner's corporate policies, plans and priorities, Marie has oversight of the legal work, budget, risk management and internal processes for the whole organisation. She also makes sure the Office walks the talk when it comes to sustainable development and operates efficiently and sustainably. She is now our lead for the Health Mission under the second Commissioner, which she co-designed with stakeholders and our team. So I'm just going to go through a little bit of housekeeping before we go into the presentation. So firstly, after the presentation, there will be a poll for you to feed back in. So we'll be asking you some questions, so it'll be a bit interactive. And there will also be a chance for you to ask us questions through a question and answer session. So please use the chat to type in your questions throughout the webinar, and we welcome both English and Welsh contributions. The webinar is being recorded and will be made available on the Public Health Network Cymru's website after the session. If you experience any difficulties with the technology, please let us know through the chat and the team can contact you directly. And then finally, the views and opinions expressed in this webinar are those of the speakers and do not necessarily reflect the views or positions of Public Health Network Cymru or Public Health Wales or any of its affiliates. So just to begin with, I will talk a little bit about the Future Generations report and then Marie will go into detail about the health mission itself. So the Future Generations report is a report that we publish 1 year before the Senedd elections with recommendations to both Welsh Government and public bodies on how to improve the implementation of the Act. So this has been historically every 5 years, but it will be moving to every 4 years due to the changing of the term length for the Senedd elections. We have set out this report according to our Cymru Can core missions alongside advice on how to set good wellbeing objectives and steps and how to act in a long-term manner through that the Future is Now chapter, and the annexes include more detail on the evidence that we've used in order to develop this report. In our report, we recognise the positive, so we take stock of where implementation has got to until now, and we recognise the positive that the Act is working as a means to set out a good vision for people within Cymru to deliver against sustainable development. It's driving real action and is a great source of pride across all sectors within Wales. We do, however, also recognise the multiple challenges facing implementation, such as the funding, availability for the public sector and voluntary sectors across Wales, as well as the complex systems-based nature of current and future challenges. So this might relate to our food system, access to culture and heritage, difficulties accessing the Welsh language, the partnership landscape being very complex, and the ongoing kind of erosion of trust in public institutions. We do, however, recognise that these changes aren't insurmountable, and we're calling on public bodies to take as much action as they can today in order to see a brighter future for future generations. In this report, we have set out 50 recommendations overall. So 27 of these are specific to Welsh Government, so only to Welsh Government, and then 23 of these recommendations are for public bodies, 18 of which are also applicable to Welsh Government. Marie will now talk through our key recommendations under the health chapter. Thank you.
You're on mute, Marie. Sorry about that. Thank you very much, Jenny, for this introduction. And so this webinar is focusing on the health chapter of the Future Generations report. And it is really important to remember that all dimensions of well-being are intertwined. So there is a Healthier Wales goal in the Act, but it is important to remember that it interacts and it is connected with all of the other goals, and that all the other goals apply and impact the health element. We separated the Future Generations report, as Jenny explained, according to our missions. But the Future Generations report needs to be considered as a whole, as all missions address different facets of our collective well-being. So the chapter starts by painting a picture of the situation in Wales. So health is a topic, health and social care is one of the key topics which people always talk to us about. And we also know that people really value the NHS and they see it as one of the most important institutions. But we are also seeing a clear disconnect between what people think and what science tells us. For example, people think access to health services is a main determinant of their health, whereas studies from the WHO, for example, are showing us that it only amounts to 10 to 20%. So we have used in the Future Generations report, the Wellbeing of Wales report, which is produced by the chief statistician, so independent from Welsh government, reports against the national indicators to show progress. And you can see here that for health, nearly all health indicators are going the wrong way. Life expectancy is decreasing for the first time, twice in a row. Healthy life expectancy is also decreasing. Inequalities remain, are even increasing. Obesity is increasing. Mental health challenges are increasing. And except for some heart diseases and smoking, the trends or the situation is definitely not what we want it to be. And if we look at the future and trends, things are starting to get very bleak. Did you know that we can all expect in 2025 in Wales to spend the last 20 years of our life in ill health? 20 years. I would have settled for maybe 1 or 2 of my last years of life to be in ill health, definitely not 20. And that's set to even continue to increase. And in Torfaen today, the healthy life expectancy of some women in the most deprived community is only 44 years old. Imagine that, staying healthy only until you are 44. So that's what we are talking about. In addition to this, our population is aging, and we already had the oldest population in the UK. And if we look at resources, a lot of health and social care workers will retire in the next 10 years. Some estimate it might be up to 30% of the whole workforce. Then less young people are coming on the job market, which is increasing a workforce gap. Then budgets are not anticipated to increase They are even likely to decrease, while the demand, as we have seen, is continuing to increase. So we have a recipe for a perfect storm, and that's why we need to transform. I'm sure at this stage you need some good news. So you will see we are seeing examples of good practice. Things are improving in places in terms of practice, but we conclude in this report that the pace of change and transformation needs to be much bigger and faster. So let's look now at the key findings for the health chapter, which are the basis for the recommendations that we have made. So the first finding of the report relates to well-being objectives. Many of you might know that our role is to promote sustainable development, its principles, and also to monitor and assess progress against meeting well-being objectives. And for us, that includes looking at the quality and contents of these well-being objectives. So our conclusion is that we are seeing huge disparities in the way public bodies implement the social model of health through their well-being objectives. Some are really doing it, while some are much more traditional. For example, some local health boards are still very much focused on the clinical model of health, which means treating illness, a focus on secondary care, missing some of the prevention opportunities or the important need to build community resilience. We see some traditional approaches as well in other sectors, for example, in the fire and rescue services. And overall, only 15% of all well-being objectives focus on health. So this shows that not everyone is thinking of the health in all policies, the social model, especially outside of the health and care sector. Also, many organizations are not seeing the bigger picture. There are not enough objectives focused on the staff well-being, nature, as well as decarbonization, building resilience of communities and the environment. And there are also gaps. For example, mental health is a growing issue for all sectors, but there are only 1.5% of objectives relating to it. We are also not seeing enough of an alignment with the evidence provided in the regional partnership boards' population assessments, the Public Services Board's well-being assessments, and NRW area statements. So the objectives do not answer directly the issues raised by these assessments. Then we need the objectives to embrace more opportunities to collaborate and involve communities. We need them to help contribute more to each of the 7 well-being goals. So, for example, they need to do more on community cohesion, nature recovery, or global responsibility. So all of these are also advice which we are expecting to be implemented as well as public bodies set up their next round of well-being objectives after the CNS and local government elections. The second finding won't surprise you, I am sure. And it is that the health and care sector is still very much focused on acute, despite a wide consensus on the importance of prevention. We are even seeing a visibly growing sentiment and commitment to prevention. But in practice, we are seeing that the services are still focused on the delivery of acute services. So last year, we did a workshop with the directors of health and planning in the health sector, and we asked them how much of their budget they thought should be spent on prevention. And I was quite surprised, happily so. The numbers were more where I expected them to be, and they said that around 10 to 40% of their budget should be spent on prevention. You contrast with the Office of National Statistics, which estimated that in England and Wales, only 5% of NHS spend is on prevention. but I think no one really knows, and I'll come back to that later in this presentation. So positively, we are seeing progress, in particular an increased investment in early intervention, which is not always prevention, but can be, in early years and poverty, which are crucial to reducing inequalities. And we will see some good examples of that in the presentation. But then funding comes into play. Funding for prevention is often for short-term pilots, it's piecemeal, and it's driven by very short budget cycle. Local health boards told us that Welsh Government performance and assurance demands, as well as the funding, reinforce the short-term focus, making it really hard for them to focus on the long term and on prevention. And this is why our office with key stakeholders have been working with Welsh Government to ensure that prevention and population health become a strategic priority in resource planning, so through IMTPs. We have also worked with Welsh Government to agree of a definition of the different levels of prevention, which is easy to understand and easy to apply, so to help us map budgets and investment, as well as to drive activity for different segments of the population. And we'll talk more about that. So in the report, we acknowledge that budget is key for the health and care sector, key as a blocker, and also because of the increasing proportion that our national budget is dedicating to health, making it unsustainable in the long term. The third, that was the definition we have agreed with Welsh Government for your reference. The third finding is about system thinking, because we believe that system thinking is a very important part of the solutions. System thinking chimes with the 5 ways of working in the Act. It's about collaboration, integration, involvement to help prevent and to help maximize opportunities for the longer term. System thinking is here to break the silos and to prevent us from only focusing on a small part of a system or of a problem, making it nearly impossible to solve. We are also seeing an increase in its use at the national level through some of Welsh Government's policies, for example, the mental health strategy or the healthy weight. And this is really important because previous strategies had failed to make a dent in the growing trends. At the regional level, we have good examples, for example, with the Gwent Marmot region, or the Shaping Places, a project between the Health Foundation and Public Health Wales to enable public services boards to use system thinking to address the wider determinants of health of their populations. But the projects have shown many problems with the operation of public services boards, and this is considered in another part of the Future Generations report in the implementation and impact chapter, if you are interested. Then at the local level, we are seeing a rise of well-being hubs with wide services which go beyond health and well-being, including advice on housing or finance. And we are seeing more and more place-based approaches, like, for example, in Torvine. So system thinking is really a key part of implementing and designing long-lasting and effective solutions as demanded by the Wellbeing of Future Generations Act. And we want to see much more of those in the future. The next finding, very sadly, is that inequalities are not decreasing, but increasing. And personally, I find it is reaching an unacceptable level in the 21st century. To paint a picture of what we are talking about, people living in our most deprived communities are twice as likely to die of preventable causes. I will repeat that because it really shocks me. Twice as likely to die of preventable causes. So we welcome the Welsh Government action plans about anti-racism, LGBTQ+, disability equity to come. But again, we are disappointed in the progress in the implementation. And as well, Public Health Wales called them, the triple challenges of Brexit, COVID, and the climate have exacerbated even further existing inequalities. But we are seeing good practice to address this, for example, through using the inverse care law model. But some of these projects have been closed following on budget cuts. So part of the solution is to improve the wider determinants of health, the jobs, our homes, educations, our environments, and social connections. The socio-economic duty has also come into force, and we hope that the upcoming health impact assessments, which are to become mandatory, will really help the situation. Finally, reports after reports, and I am sure our collective experience, show that the health and care system in Wales is far too complex to be effective, to enable proper accountability, and to improve our health. It creates confusions, slows progress, increases inefficiency, adding more pressure on an already pressurized system. And in another chapter of the Future Generations report, we have recommended that Welsh Government simplifies this as a matter of urgency. So that leads us to the recommendations. There are 6 recommendations in the health chapter, 3 for Welsh Government alone, and 3 for all public bodies, including Welsh Government. So let's start by those for everyone. So we recommend that all public bodies adopt system thinking and place-based approaches to implement the social model of health everywhere at all levels. The second one is that public bodies should include prevention as a core corporate objective in order to prioritize it, make it visible, and to make it much more purposeful and drive investment. Then, public bodies and PSBs should look at all the assessments available for their populations, population assessments, well-being assessments, area statements, and the Well-being of Wales report by the Welsh Government to design specific plans to reduce the specific inequalities of their populations. Looking at Welsh Government's recommendation, the first one is that in order to ensure consistent and systematic use of the social model of health and place-based solutions, Wales should become a Marmot nation. And we are delighted that the Welsh Government has already committed to doing this and that work has already started on this. The second recommendation is that Welsh Government and the NHS executive, and please forgive me, I have forgotten their new name, should ensure and embed prevention in all the clinical pathways. And this is in order not to have prevention as an add-on, is to ensure that it is included in and is part of an existing systems with people, which people are familiar with. And the very last recommendation is about obesity. And this is because Wales has the highest rate. Obesity is both a cause and a consequence. It is a cause of many other illnesses like heart and lungs problems, cancers, diabetes, and it is preventable. It leads to a lot of pain and pressure in the system. Then, throughout the chapter, we have dotted the pages with examples of good practice. Just to give you an example, right now, we have included the Torvine's implementation of the Marmot approach. So they have created a prevention hub, which is designed to triage all referrals and to co-design and commission care in partnership with the community. We mentioned also the North Wales, which is a partnership creating a framework for all collaborations and projects to address health inequalities and the wider determinants of Wales across the whole region. And then we have included more traditional examples of prevention. For example, here, a collaboration which led to a decrease of by 20% of all the calls to the ambulances services for falls in care homes in Powys. So now we have published the Future Generations report in April. What are the next steps for our office? And to support the shift and transformation that we really need, our office, and in particular, our very small but strong team of 3 part-timers, which you can see on the slide, we will continue to provide support and challenge to public bodies. First, we will, of course, monitor the implementation of the Future Generations report. We will continue to provide advice on the Marmot Nation, in particular to ensure that it is fully aligned with the Wellbeing Act and that implementation happens systematically across the whole of Wales. We will continue to work with Welsh Government on resource planning and IMTPs. We will convene stakeholders around mental health, in particular to ensure transformational implementation of the new mental health strategy. We will collaborate with Public Health Wales on the obesity recommendation. We will continue to showcase good practice. We will produce easily accessible future trends across health and social care. And we will also continue to promote healthy food and healthy diet, and that will occupy Jenny quite a lot in particular. And I'm leading on a preventative spend budget, which I would like to present in a few minutes because it will occupy a lot of our time in the coming 2 years. So the first purpose of this pilot is to use the definition of the different levels of prevention, which I have showed you earlier on, to map existing budgets of all public bodies. It's also a recommendation of the Future Generations report in the budget chapter. So what we are trying to do there is to gain visibility. As I told you, nobody has been able to tell me so far how much they actually spend on prevention. So that's what we are trying to understand, get it visible. As we are doing the pilot as well, we are learning more about these different levels of prevention. What is primary prevention? How is that activity classified? Is it acute? Is it tertiary prevention, etc.? So I have been having very interesting conversations in the last few months, about what is vaccination. Is it primary, secondary, or tertiary prevention? In the end, we concluded it can be both. It can be all 3 levels. It just depends on the purpose and the intention for the vaccination. So, for example, the COVID vaccination in 2020 was tertiary prevention because we were softening the effects of the disease, and other vaccinations are to prevent the occurrence of the disease in Wales. So it would be primary prevention, etc. But then all of this leads to the, for me, more important part of the project, which is the so what question. So now we know how much we spend on the different levels of prevention. Now we know what constitute and what interventions are best for different segments of the population. How does this actually influence decision-making and the chief execs and directors of finance investments decisions? So that will be a focus for many years, but a priority for our office. So thank you very much for listening to my presentation. And we are now moving to the interactive part of the webinar, and over to you, Jenny. Thank you very much.
Thank you so much, Marie, for such an interesting presentation. I hope everyone else agrees it did well to illustrate the challenges that we're facing here in Wales, as well as some solutions and recommendations on how they can be addressed and how our office can support you implementing those going forward. So there should be some polls put into the chat that you can access soon. So first, I can see mine popping up. So I just wanted to ask you firstly, which recommendations do you think should be prioritised? Secondly, what is your organisation already doing to meet the recommendations? We'd really like to hear any examples of good practice that you're doing or that you know of. And then finally, what further actions do you think your organisation should be taking to help meet these recommendations? And I'll give you a few minutes to have a think about those. And also just a reminder, if you have any further questions, please, or any questions for Marie, then please put that in the chat in English or in Welsh. So I'm seeing some of the results coming through, which is really interesting. To see that the recommendation that we're setting on that Welsh government should develop a plan to halt the rise in obesity within 5 years and reverse it within 10 seems to be quite popular, as well as embedding prevention at the start of all clinical pathways. Good to see examples such as the food partnerships being highlighted under question 2. I work with those sometimes in developing some of our recommendations. And yes, I think we agree that measuring and committing to increase the proportion of spending on prevention is, of course, something that we'd like to see from the office across bodies, but also recognise it is challenging. So please do get in touch with us if you'd like to learn more about our pilot and how we can support on that work. This is fantastic. Thanks so much for all of your contributions here. Perhaps we could share some of these findings after the webinar. And I think we're almost at 50 responses, so we might move on to the question and answer, but keep filling in the poll if you're still thinking as we go. Are you happy if we move on to questions, Marie? Fantastic. So the first question I've got here is from Roger Seddon. He asks, the report, as shown in slide 3, focuses on the wellbeing goals, but trusts concentrate on wellbeing objectives that are reviewed on an annual basis. Do you monitor changes in their objectives?
Yeah, Jenny, that might be even a question for you because it's part of your role in the office. So yes, we are monitoring changes in the objectives. And as I said, Jenny, it's Jenny's role in our organization. So Jenny, do you want to tell us a bit more about that?
Yeah, of course. So we have been monitoring the changes in how public bodies have been setting their wellbeing objectives, and then using that to inform the work that we're doing and how we engage with different public bodies and public service boards. The changes are quite there are challenges around that because the timelines from which public bodies refresh their wellbeing objectives are not the same across all public bodies. So we tend to kind of maybe take stock every few years to change to review how they've changed. We review how they align to the different wellbeing goals, how the steps set out align to the different 5 ways of working, and have found some key findings such as involvement being used maybe a little bit less than other 5 ways of working, but positively we've really seen an increase on steps that relate to prevention and long term, which we're really welcoming. The work has also informed some of our priorities, so recognising that in terms of the way that a lot of bodies talk about health and health prevention has often been relating to exercise and activity, which is of course a really important part of that, but recognising there's maybe a bit of a gap of work around diet and health and food. So we've seen an increase in ambition around that, but using that as a way to engage with public bodies on how they can drive further action on health prevention. There are some findings in our Future Generations report on this work. So we commissioned the Institute of Welsh Affairs to update our research on this as well. So you can see some more findings on there within the report. Thank you.
Yeah, and Jenny, it might be worth adding as well that we are trying to work with Welsh Government on how we can show representation on a map of Wales of the well-being objectives of everyone, so we can get, a visual spatial understanding of what the well-being objectives are and keep that up to date. As you rightly say, they keep on evolving. And every year, public bodies should consider reviewing their well-being objectives, and they have to review them when there's a change of goals and after each of the Future Generations report.
Absolutely. So we've got another question here from Rosemary Jones, who asks, are there any specific recommendations for Welsh Government on the how to achieve the Marmot Nation principles?
So there are not specific elements inside the report, but it's something we have been thinking about. So, for example, I'm thinking about how the Marmot principles, which are really well known, can be slightly amended so they're aligned better with the well-being goals. So, for example, in the Marmot principles, I believe there's not enough on the environment. There is some, but we could widen it. And there's nothing about the Welsh language and culture. So that's something we would like to add. I would also like to align their indicators with our national indicators. And Sir Marmot himself is keen, and I've spoken to him several times, and he's keen to work with us to make sure we have this perfect alignment of his model, but in the Welsh context of the Welsh Marmot Nation.
Thank you, Marie. Absolutely. So there's a question here about the kind of rural-urban divide, or a comment here that you might want to reflect on or provide some reflections on, Marie. So Anna asks or says, there is still a considerable rural-urban divide too in terms of unequal access to services and support, which needs to be at the forefront of addressing inequalities across Wales.
Yeah. It's really an important issue and something we are starting to work on. And I was particularly impressed with Iceland, where they have a similar divide of their cities and a rural element. And I'd like to learn more from their good practice, where, for example, they have trained lots of local leaders. Or in Alaska as well, they are doing something like that, where local leaders are trained by the NHS to do the work of a pharmacist, a GP, or without the full medical training. They can even prescribe some medication in some cases, but this needs to be approved by a local or a further remote GP, maybe in a city or elsewhere. So it's something we are starting to look at as an office, but we recognize it, and again we are looking at potential solutions for the longer term as well, because we know that migration towards cities is what is actually the longest trend which has existed in humanity. So, you know, humans come and create cities which grow and grow and grow. And so we know the problem or the situation will continue to evolve. And yeah, it's something we will continue to look into and a bit more in coming years.
Yeah, I think you highlight a really important point there, that a lot of these challenges that we're facing in Wales might be quite extreme in Wales and presenting quite extreme statistics, but a lot of them are similar to other countries, and there's so much we can learn and they can learn from us in terms of the way that these issues can be addressed. So yeah, really interesting example. Thank you. There's a question here from Jonathan Davies here saying, fully supportive of a preventative approach. However, it's a huge challenge to divert limited funding from dealing with acute embedded issues. Is there any advice on how to move to a more preventative approach within budget constraints without impacting on dealing with the acute issue?
Yes, and that's what I am grappling with every day for the last, I would say, good 6 months now. And so there are different elements of work we are doing on this. So I will be joining a West Wales partnership around the wellbeing economy from Hawelsa and Swansea Bay, where I'm hoping to have these conversations of where can we find funding in order to fund prevention. It's really important to understand it's not adding new money, or it doesn't exist, it's not possible. So it's how do we shift existing resources? So I'm starting to ask everyone I come across, like, what do you think can be done, especially within the clinical setting? So people are talking about, you know, medication. There's apparently still so much waste of medication across Wales. So I'm just talking with my friends and colleagues, you know, we all find bags and bags of medicine by our older relatives, which haven't been used and they are still delivered at their homes, etc. Then people talk about still stock management. Others talk about low impact surgeries, you know, for example, surgeries for tonsils or varicose veins, which have low impact or benefits proven. So to maybe stopping doing this, but it's part of the conversations we really want to have. And I'm working with Welsh Government, and we are hoping to do workshops across Wales to have these conversations exactly on where can we find the funding and what do we stop doing, and to enable us to do more prevention at all levels, so primary care, secondary care, and tertiary care as well.
Absolutely. Yeah, I think that engagement piece is really important, and understanding how, because it will be different for all sorts of organisations. So thank you for those reflections. There's a comment here from Becky Ricketts. She says, we need to address poverty and income as a form of prevention. If people are constantly financially struggling, this will undoubtedly have a disproportionate effect on healthy life expectancy. We think of prevention as too clinical, and it needs to be wider and more holistic. This, for me, is one of the biggest influences of poor health. Do you have any reflections on that and how it relates to our mission?
Yes, yeah, and I totally agree. for me, money and income is really the first determinant of health. I think it's well recognized, with the social model of health and the wider determinants model. And that's why, our act has got these 7 well-being goals intertwined, and a prosperous Wales is one of them, because it's a very important part and determinant of our health and well-being. So I totally agree with you. It's also a main driver of the inequalities, which in terms, exacerbates the whole system, and creates more inequalities. So that's why also in our office we have a well-being economy mission. It's to ensure, we do business economy differently, and that we put people and planet first. And that will also help our health, of course. Yeah.
Absolutely. I'll just add we're doing a lot of action around Real Living Wage Week in November, encouraging as many organisations to sign up and pledge to implement the real living wage, which would be a key lever to lift or reduce poverty in Wales. So I guess look out for our work on that as well.
And join in the movement, as Jenny
yes,
said,
please.
Please ensure your organizations become accredited.
Absolutely. So there's a comment here from Sharon Breward. Wales public health is built on sand. Most of the issues mentioned today, obesity, diabetes, etc., have their roots in early life. Around 60 to 70% of Welsh babies are not breastfed by just 10 days of age. The impact of the absence of breastfeeding and lactation from the lives of Welsh women and their babies is profound, yet we have no effective investment to address this as a nation.
Right. So I know Public Health Wales has done so much work on the issue, and I've seen many reports and very strong evidence of the importance and impact of breastfeeding children. So it's definitely part of something we raise as examples, and as an office we do everything we can as well to support this, and any work on early years. And I was part of groups, working on guidance again with Public Health Wales, and so we can really look at early years and poverty, because as I said in the presentations, they are really fundamental elements to improve our health, but also to reduce inequalities across the board.
Absolutely. So there's a comment here from Anna Privik. Food is core to health and well-being, not only physical but mental health through providing socialization opportunities, etc. The proliferation of ultra-processed food still used in schools and promoted in hospitals and public sector places is ridiculous. We should look at countries like Australia and Japan that mainly use locally sourced fresh foods in their school dinners. Big change is needed. The recent schools dinner consultation did not go far enough in addressing the impact of poor diet on our younger generation.
Yep, so totally agree. And we've even read, really interesting research and evidence as well of the chemical effect of junk food on our biome, and how it is also driving mental health illness. So that's yet another element of the relationship between food and mental health. And Jenny, because again, it's one of your areas in the office, I won't steal your thunder. Do you want to say a bit more about our work on food and exactly agreeing to what is said? And it's also food is how do we call them? A focused area. It's at the cross of all of our missions, so that's why it's an area of focus in our office. So over to you, Jenny.
Yeah, so we when we developed the Cymru Can strategy that the Future Generations report is sort of structured around, we identified food as an area that cross-cuts across all mission areas and well-being goals, as it touches all areas of sustainable development. So there is a chapter in the report about this, and we do have recommendations in there about reducing procurement of food that is high in fat, salt, and sugar, and also ultra-processed foods. We recommend that Welsh Government develops a integrated food strategy, and that also local authorities can do that themselves as well, take it on their own backs to identify what their levers are for improving food systems and change it themselves. We really welcome, for example, that the Vale of Glamorgan have pledged to reduce or eliminate advertising of food that is high in fat, salt and sugar. So we completely agree with your comment and would love to see more action on food systems. You can find out more information within the Future Generations report and on our website. And again, please get in touch if you'd like to support us on this work. We are currently developing guidance for local authorities on how they can improve these food environments, and also just want to recognise the work of the food partnerships across Wales who are taking huge amounts of steps in delivering this work, such as the brilliant Welsh Veg in Schools project. Thank you. I don't know how much time we've got, maybe one more question. So maybe from Peter asking whether you could give an example of where prevention's been embedded within clinical pathways or what that might look like.
We have examples around mainly use of things like, crutches or elements like that, where I cannot come up right now. I've just come back from holidays. Apologies of an example off top of my head on this. But what I have started doing on this particular issue is to work with Public Health Wales and their team, so we can come up with very clear and specific advice over the coming year, I would say. So it's really a question of watch this space, and something we want to explore and co-design with patients as well as clinicians and Welsh Government, NHS executive, others. So we can co-design again, so for use the 5 ways of working to really determine that. Because in some pathways, nurses would tell us, oh yes, my advice is to do this and that, and to prevent that type. In diabetes management, we can find lots of examples, for example, of where prevention has been embedded, advice on the diets, activities, to treat the condition, but also to prevent it from reoccurring in the future. And so it's really learning from what we know is working or not. But again, we want to co-design the detail behind all these things.
Thank you so much. And thank you so much, everyone, for all your really interesting and thought-provoking questions. We're coming to the end of the session, so that's all we have time for today. But thank you to Marie and for Public Health Wales for this presentation. We would be really grateful if everyone who has joined the webinar could complete a short poll, which should be sent into the chat now. Yeah, I've just got this. I could see it popping up too. So a link has been included and will also be sent to you. We really hope you will join the Public Health Network Cymru if you're not already a member. And finally, if you have any thoughts on future webinar topics, you can let the team know at Public Health Network Cymru. We, as I said, myself, Jenny, and my colleague Marie are also really open to being contacted about the report and how we can help you if you're interested in implementing any of these recommendations or all of the recommendations that we've talked through today. The Future Generations report is available on our website in both English and Welsh, and an executive summary as well, which sets out the key findings and recommendations within the report. So please do get in touch, and thank you so much for your time. I'll give you a couple of minutes just to fill out the poll, because I know feedback is very useful. Thank you.